The question was, what is GERD? That stands for gastroesophageal reflux disease, and we're going to talk about reflux and as well as the disease portion of that. But in complete layman's terms, it's the refluxing of stomach contents going up into the esophagus. So that is the basic idea, and really the definition by our medical definition is that it is where you have either troublesome symptoms or you have actual tissue damage. So if you have symptoms more than twice a week, or you have symptoms that are affecting your lifestyle and quality of life, that would qualify you as suffering from GERD. And or if you've had tissue damage to your esophagus, then that also puts you in the GERD category and not someone who just simply has some acid reflux. So let's define GERD. What is GERD? GERD is an acronym for gastroesophageal reflux disease. And I want to focus on two things there. One is reflux and one is disease. Because recognizing that it is a disease is extremely important, because the way we treat this disease currently in the United States and most westernized countries is to merely treat a symptom. That is, we're treating acid with things like Nexium or Prilosec or Zantac, Pepcid, things of this nature. So we need to really step back and get a handle on what this is and then really look at the way to treat it. And I'm just going to suggest to you right off the bat that the way we treat this disease is by treating reflux. And reflux comes from a failed or incompetent lower esophageal sphincter, the sphincter that's supposed to be a one-way valve between your esophagus and your stomach. And we're going to touch on that a little bit later. GERD has become a real problem in the United States and westernized countries. It's really of epidemic proportions. So up to 20 million Americans are suffering daily from this disease. And in fact, the definition of GERD is that you are either suffering twice a week from heartburn type symptoms, that it's affecting your quality of life and activities in your life, and or that you have actual damage to your esophagus secondary to gastroesophageal reflux. So we have at least 20 million Americans who absolutely have this disease, and about 40 million Americans experience GERD on a weekly basis. So probably another 10 million Americans are there at twice a week symptoms, which would put them in the GERD category. How do you know if you have GERD without visiting your physician? Well, I would definitely suggest visiting a physician and sitting down and talking with him or her about GERD and trying to look and see if you have the symptoms. But if you're one of those folks who's either taking Tums or Rolaids every single day and it's always with you in your pocket or your shirt pocket, then likely you have GERD. If you're having to take Zantac, Pepcid, or any of the other drugs such as Nexium, Prilosec on a daily basis, you may have GERD. And counter to what you hear on television from folks like Larry the Cable Guy, you need to go and visit your physician, because as we'll see later in these talks, this is a progressive disease that can lead to esophageal cancer. The 5-year survival of someone developing esophageal cancer related to GERD is about 15%. It means that 85% of patients are not going to survive 5 years with esophageal cancer. So we need to get tested, diagnosed, and treated appropriately. And the symptoms of GERD are myriad. So the classic one is heartburn. That is a symptom, that's not a disease in and of itself. So patients that feel that kind of pain after eating right here, right behind their sternum. So that's the classic one. But then you can look at regurgitation, patients who are sensing that things are coming up from their stomach and up into the esophagus and even sometimes into their throat. Then you can look at a whole host of other symptoms such as burning in the throat, cough. You can have what they call a globus sensation, which is to say a kind of a lump in the throat, or some patients say they feel like a hoof on their throat. You can have chronic throat clearing as well as pain in the throat and even voice changes. It's reflux of contents from the stomach moving through the sphincter, which was designed to let things go in but not really come up, and then those can reflux back into your esophagus and even as high up into your throat. So it's the contents of the stomach moving into your esophagus and other areas that really defines GERD and reflux. as I mentioned earlier, we treat this by taking away acid, but acid is really just a small component of what is in this refluxate, or the things that are coming back up into your esophagus. So we've got bile, food, other liquids. We have digestive enzymes that can embed themselves in the tissues of the esophagus and the throat, and these are really what are causing the problems related to GERD and heartburn, etc. In fact, it's now fairly well established that it's really the bile reflux that is causing much of the damage here, and we do not have any effective medication to treat bile reflux, which is why when we look at studies, we see that surgery is so effective in treating the symptoms as well as the disease, stopping progression of disease in patients who undergo surgery. And we're going to spend a significant portion of this talk discussing some of those surgeries. And so as we discussed, it is reflux of contents coming from the stomach up into the esophagus. And the cause, and this is a little bit of a myth, is not acid. So acid is a component of the gastric contents, but most of the issues surrounding GERD have nothing to do with acid, although certainly, and we'll get to this is how we treat it. The problem is that we have a bad sphincter at the lower esophagus, right where the esophagus joins the stomach, and this sphincter is supposed to be a one-way valve. Unfortunately, it doesn't always work that way, and some reflux can be normal in humans. However, it becomes a real bad problem when it becomes all the time. So it's really an issue of the sphincter and not of acid. So let's talk a little bit more about GERD. GERD is a huge problem right now in the United States and in fact all westernized countries. So we know that 20 to 30% of patients suffer from GERD at least weekly. So again, that puts you in that GERD category if it's 2 or more times a week. And about 10% of the population, 20 million Americans, are suffering with heartburn and other GERD symptoms and complications daily. That's a huge number of patients. Most of those patients are on some type of antacid or acid reducer. This disease is becoming more prevalent, and in fact it's really at epidemic proportions. And I'm often asked, why is it becoming more prevalent? Well, we don't know. Again, it's probably a combination of diet, lifestyle, sort of general population obesity, although certainly you don't need to be obese to have these symptoms. And so we don't really have a great handle on why it's becoming such a problem. We just know that it is. Part of it too may be a little bit better diagnosis, but it's certainly becoming more and more of a problem. In fact, we talked earlier a little bit about GERD progression and cancer. And there's lots of information out there and you can search it on the internet, but we have esophageal cancer becoming an epidemic as well. And in fact, the type of esophageal cancer that comes from GERD is the fastest growing cancer, again, in westernized countries. In fact, just as we got these great drugs, like we talked about earlier, for the treatment of the symptoms of GERD, heartburn, in the 1970s, it was when the first ones came out, we have seen a skyrocketing increase in esophageal cancer. In fact, it's grown 600% since 1975. And this is not due to, quote, under-treatment of the symptoms of this disease. Again, those drugs are pretty good at taking care of the symptoms. Not perfect. About 30 to 40% of patients have breakthrough symptoms even on maximum medical therapy. But it's not from a lack of taking PPIs that patients are developing esophageal cancer. We're doing something fundamentally wrong in treating this disease that's leading to this huge increase. So we've got to do a better job of taking care of the disease. And we know that in multiple studies that surgery is treating the disease, not simply treating a symptom. So that's where surgery can fit in to the progression and treatment of GERD. So I'm often asked, how long does the Lynx device last? And this really dovetails with another thing, which is how long does a Nissen last? And unfortunately, there's a lot of mythology out there suggesting that a Nissen is going to fail at 10 years, and that is simply not true. I want to repeat that. That is simply not true. So does the Nissen fail? And the answer is yes, occasionally. But again, we have 20-year data out suggesting that at least 80% of patients are satisfied and are off their medications with a Nissen fundoplication. So it's not that it's going to fail at 10 years, but there is some truth to the idea that when you're using your body's own natural tissues to create something, they can wear out. And we do see that occasionally. And I do a fair amount of revisional surgery for failed Nissens. As far as the LINX procedure goes, that device was rigorously tested through FDA trials. It was opened and closed millions and millions of times, many more millions of times than you would ever be able to swallow. And the magnets are rare earth magnets. So the expectation is that this is going to last at a lifetime. The device is not going to fail. You could probably pass it on to your kids and grandkids and it would work just great. I don't know if future surgeons would appreciate me saying that, but I think that that's true.